another exciting episode of MedTech Talk, where we explore the latest innovations in medical technology. Joining us today is Dr. Abhay Chopada, a distinguished colorectal surgeon and an influential thought leader in the fields of health and artificial intelligence. Welcome, Dr. Abhay.
Thank you for inviting me, Meenal. Really a pleasure to talk with you once again.
Thank you so much. So, today we are here to talk about managing healthcare emergencies and what role AI plays in this sector. So,
Interesting topic.
yes, it is quite an interesting topic. So, what are the key technologies driving advancements in emergency healthcare today, doctor?
Uh, okay, you're opening up a Pandora's box. Emergency medicine is life-saving medicine, and today I'm sorry to say, but the key challenges of healthcare are the real reasons why we lose a lot of lives. Access to healthcare, availability of healthcare, and affordability of healthcare all remain a challenge. But they're particularly so in emergency medicine because you are literally in a life or death situation in emergency medicine. I'm so glad to see that now technology is starting to chip in order to address the issues of accessibility, availability, and affordability. It's kind of a motto of Axon Care that we do. But the bottom line is in emergency medicine, the requirement is very straightforward. You need to be able to access to the right caregiver. So let's assume I'm in a rural area and I'm a woman and I go into labor and I start bleeding. If I don't have access to a gynecologist or an obstetrician who can intervene immediately, I'm likely to lose my life. Now, today the challenge is, you try to manage with whatever limited resources, and if you don't manage it, essentially someone loses their life. So, technology today actually can create a bridge, and we can start monitoring people who currently have no access to healthcare in advance, potentially to foresee or prevent emergency scenarios. And I'll give you a very interesting story, which has something that stuck with me for my life. So I was a young resident in surgery, and we had a young man about 17, maximum 18, who came in an extremely unwell scenario. He was really, really unwell. His heart rate was very high, his blood pressure, and he was in septic shock basically. We operated on him. We did a laparotomy, and to our utter surprise, he merely had a perforated appendix. And we operated, but unfortunately, a few hours later, he succumbed to his septic shock. We couldn't revive him. This was in India, in Pune. And I actually got really upset as to why did the parents delay getting the child to the hospital so late. They should have brought him a lot earlier and would have saved the child. That was my thinking. And I'll tell you, the father later on, when I actually said, you should have brought your son earlier, he started crying. And I felt really guilty. And so he said, listen, I'll tell you what happened. So I said, okay. And what had happened is the son actually started noticing pain in his abdomen about 5 days prior. But they didn't have, so they went to the local doctor, and the local doctor said, let's watch it for 24 hours. I'll give you some medicines. And if it's not better, take him to the city. He will need to be seen by the doctors in the city.
Right.
2 hours later, he was no better. So they took him to the local doctor again and said, take him to Sassoon Hospital, which is the Pune's government hospital. Now, this man in his head calculated that he'll need 30 rupees into two, so 60 rupees as a ticket for the local bus, which was going to take them to the hospital in the city. He didn't have 60 rupees. He was a very poor man. So what he thought was, okay, my son needs to be seen in the city. What I'll do is I'll quickly sell some utensils from my house and I'll take him to the city. So on the third day, he took utensils out of the house, went to the nearby village, sold it, and came back walking, and in order to save money. So it was only on the fourth day that he actually took his son and brought him to Sassoon Hospital. Now, this delay of 4 days meant that the son, who previously just had a simple perforated appendix, went from being someone who was fairly straightforward to manage to septic shock, which became irrecoverable. How many hours are we talking? 72 hours. 72 hours was enough to change a situation from manageable to absolutely, loss of life. That is such a big lesson as to why access to healthcare is so vital. Today, the statistics say that 30,000 children die in Africa every year due to diarrhea. Diarrhea is not a lethal disease. Cholera is a big killer. And what is the treatment of cholera? Salt water. rice water with sugar in it. But there's no one to tell that message to the mother who's got that child with cholera. So access to information, access to someone who's empowered is really the single most important thing that is needed in emergency medicine. And today I'm so glad that we built a health ATM to do exactly that. I don't need a doctor in the rural area. I can put an ATM there. You take your child there. Had I been the doctor on the ATM, I would have literally told the father that, hey, listen, forget about getting the 60 rupees for your bus. Hire the local vehicle, get him to the hospital, and I'll pay for the trip. It'll cost me 200 rupees. What's the most? £2
Right.
in UK terms. Because I understand what is the importance of his heart rate and blood pressure. I would have actually got it measured. I would have saved that life for £2. But that is because I understand. So, ability to pass your healthcare data in life-saving situations immediately to someone who understands how to interpret the data is the single most important revolution that is already happening and will continue to save lives as AI, other technologies get integrated. It's not just going to be about AI. It is going to be about how does that AI really impact a real human life. I'll
Right.
give you a couple other example. So, as I had mentioned in one of our earlier podcasts, today we have the ability to monitor someone's blood pressure and heart rate by merely looking at them. But I can also add on one extra layer. I can also start looking for facial edema in pregnant girls. Very easy for AI to do. And do you know that little edema on the face is usually a sign of eclampsia, something that kills a lot of women in pregnancy? Because that's facial edema. Their
Right.
body weight. I can put a weighing machine there. Now, a combination of the weight and the face is good enough for me to send an alert in the city. So that this woman is most likely eclampsia. Get her seen. Now I can do it the reverse. The woman doesn't have to tell me anything. She's feeling happy, good. I'll still get her to the local place, and if the blood pressure is high or the urine is showing me abdomen, I'll get that woman moved to the city. So, saving lives is not difficult. You just need to understand what language we need to listen to, and that language will be interpreted using AI. That is how I see it.
Right. So that is what it is. Like AI is going to help us avert so many tragic experiences which are merely due to delay in, proper health care. So, what are some of the significant challenges you have encountered in integrating AI into emergency healthcare?
Multiple challenges. First of all, emergency medicine is full of people who are not from the technical space. So there's a huge inertia. The work practices are pretty ingrained, and no one likes to change anything. The second big challenge is emergency medicine. Don't look at it only from an urban eye set. Urban mindset will only allow you to see those busy emergencies and the casualty program that you watch on television. Real emergency medicine happens in rural areas where there's no one to cater for the patient. And they need to be educated. Imagine, let's assume I go to rural Africa. I might not have electricity. The question is, how will AI even work? Right? I need to have at least a bandwidth and electricity to pass the data for the AI bot to understand or pass it to the cloud.
Right.
Today, we have to start thinking about not just AI. We have to think about human life from a basic infrastructure perspective. Luckily, I will tell you, the world is very rapidly giving data. Even in the remotest parts of Africa today, you get a mobile signal. And electricity is also now, especially with green energy initiatives. There are a lot of startups that are giving you electricity locally through solar or through wind. We are not dependent on big grids. So we will
Right.
solve those problems as well hand in hand. But emergency medicine will need to work alongside all these other innovations to transform itself. It's not just going to be about medicine. Let me put a second problem. Let's assume I do make a diagnosis. Now I still need intervention. How will I get my medicines to the patient? How will I transport my patient to the place of care where it is going to be relevant? Now you will say, okay, today, oh, we haven't thought about that. Where is the medicine going to come from? So we are working on drones. So government of India has taken a pilot project where the person who's diagnosed with a condition can be sent his medicine by drone. So now
Wow.
imagine I've made a diagnosis within the next 20 minutes, your medicines are with you. That's going to save a lot of lives. So
Wow.
we have to be innovative. We don't have to look at the problem from a single lens. I'm going to say it's going to be a collective effort. And all those little hurdles that are all practical real world hurdles will automatically get resolved when the collective human wisdom resolves to solve it.
Right.